Hi guys, how we doing? It's Greg here from the YouTube channel Growing Older Gratefully. I hope everybody's having a good night. It's a little bit after 8 p.m. Central Time here in Fort Walton Beach, Florida. I didn't do a video blog yesterday, so I'd like to talk about yesterday a little bit. So yesterday I had a very good day. I got some exercise in. I've got some stretching in. I was having a very good day till really probably about later in the evening, and it kind of was sinking into me about today's appointment. Remember, I had said Friday was D-Day. I had an appointment today with my doctor, my surgeon. So with that, it was one of those that later in the evening I was really starting to kind of have some anxiety, if you will, about what I was talking about, the second surgery part. And also the fact of the surgery I just had. So a part of me late last night, and I think, which is why I don't think I slept very well last night, was thinking, okay, I'm apprehensive. How's my surgery going? I mean, it's one of those things that I can look at it. I kind of gauge pain, I can gauge swelling, I can gauge all that, but as a non-professional, I really don't know what that would mean. So it's always been on my mind since surgery, which surgery was two weeks ago, Friday the 13th. So it was 2 weeks ago today. But like I said, as a non-professional, you don't really know what a lot of things, what they really mean till you see the professionals. So last night, apprehensive, so I didn't get the greatest of sleep. So going into today, kind of early on, just kind of antsy. My appointment with my doctor was 1 o'clock. I was trying to keep myself busy earlier. I was on the computer trying to get some work done. Nothing was seeming to kind of take away that, that feeling that, wow, I don't really know how this day is going to go. So what I did at that point is, then I started thinking about the incision itself in the wound, and I was about to jump in the shower, and I thought, and here's where I had my freak out moment, if you will. It was probably about 11 o'clock, and I thought to myself, I was just on the internet, and all of a sudden I started reading about how soon do normally they take off the bandages from the incision from surgery. Well, I'll be darned if I don't see something that says, about 7 to 10 days, and I'm thinking, oh man, today's 2 weeks. So at that point, I'm talking to my wife, and she could see I'm freaking out, and I was trying to stay relatively calm so I wasn't freaking her out. But she can see that I was real bothered. I'm thinking, well, gee, if I don't remember. And my wife was like, well, maybe they told you 7 to 10 days at some point you were supposed to take that off and redress it daily. I said, I don't remember that in the paperwork. So then at that point, I'm frantically looking through my post-op paperwork, and I didn't see anything either way. That either leave it on, don't leave it on. So then at that point, like I said, took my 5 minutes, because I told my wife, I said, well, maybe I should take it off. Maybe I should clean it, then redress it. Well, long story short, I was glad none of that happened, because what happened to me is I didn't have any dressing. I didn't have anything at home, tape or anything else to redo that. So talking to my wife as I was calming down about it, it was like, well, if nothing else, I'm just going to tell the surgeon the truth of it, that, hey, I didn't know, I wasn't told otherwise, and I figured the best person I want to look at this exposed is him. So maybe I should have taken it, maybe I shouldn't have, I don't know, but I chose not to, and that's what happened. So I went into my appointment with that attitude. Now so going to the appointment at 1, the first person I saw was a nurse, somebody I haven't met before at the clinic, very nice. They all have been very nice. But anyway, talking to her about it, she's like, oh, no, Greg. If you notice, you didn't see it in your paperwork from here, because usually we recommend, the doctor usually will follow up 10 to 14 days. And the surgeons here, they like to take that off because then they like to take a look at it. So at that point, she actually, her job was to take a look at it. So what we did there was she took a look. Oh my gosh, it looks so good, and look, everything's fine. Of course, the doctor's going to take a look at it in a few minutes. My doctor comes in. Like I said, I just love the guy to death. He came in after pleasantries of how we're doing. He took a look. I told him the same. I told him the same thing. I was freaking out about maybe I should have been cleaning. He said, "Oh no. He took a look, and the good news was he said, "Oh, fantastic." He said, "This thing, it looks great." So at that point, now, and kind of a funny story with this. Now, probably about maybe noon, after I already had taken a shower and I was just kind of sitting there hanging out, I think her title really is more, she's more like the, I wouldn't say just exclusively billing, but hers is to set up the appointment. So she's like the scheduler. So anyway, I saw that she was on my caller ID, and it was like, okay. So I'm talking to her, and her name's Autumn, real nice woman. And she was, after getting through how am I doing and so forth, she's like, well, when are we going to do the right hip? When do you want to do that? So I said, well, what's available? And remember I had said before, tentatively my surgeon had said we're going to do a month later, which would have been from the original surgery. The left, so doing the right, he had said a month later, which then I figured was the 10th of November or the 17th, because their surgeries, the way it's set up, it's always set up for Friday. So what happened at that point is she had said, well, what she had available was December 1st. So I said, well, I'll take it. And then, we kind of set up a pre-op. Then obviously at that point too, she's setting up a post-op. So I got a pre-op about a week and a half prior to that. And then same thing like with this surgery, it'll be 2 weeks later will be the post-op. So then when I had seen the doctor, as I'm getting back to my appointment, when I had seen the doctor, and like I said, after the pleasantries, he was saying, well, let's talk about the right hip and the second surgery. And I said, well, they had called me from here, and tentatively we had set up December 1st. And what's funny is he kind of gave me that look like, usually, we wait till, like the doctor sees. I said, honestly, Doc, I said, no, I got that. I know that. I know when she said that we were looking tentatively, because I told her even on the phone, well, obviously we're not making a move either way till you look at it and you say, this one's fine, and I'm fine to move on to the next one. But he kind of gave me that look, and he smiled about it. And I said, I'm sure what she was doing, she was looking out for me, that if you said it was okay, at least I was going to get a date. Because what if we're waiting around and all of a sudden these dates on these December Fridays fill in and they fill up, and the next thing you know, I'm stuck where I can't get something done before the end of the year, because remember, I'm trying, if medically possible, if it's feasible for me to do that, to get my surgeries done for insurance-wise by the end of the year. So really with that, I thought to myself, really with her calling me, and then after seeing the doctor and hearing nothing but good news, I thought this is really a blessing here, because I know my wife was very nervous about the fact that, gosh, 4 weeks after that first surgery to do a second one, that seems pretty quick, and what if your body really isn't ready, and I get all that, and I know she loves the dickens out of me, and I get that as well. But guys, we know when you got somebody that cares about you like that, then that also plays on your mind, so that I'm thinking, yeah, there's something to be said with my wife. Now she's got me a little leery about it. So now the way the time frame works, and I'm very happy, now the time frame it works is December 1st actually is 8 weeks, which is a pretty good distance, because my wife had hoped, she wanted it more like 6 to 8 weeks instead of 4, so she got her wish, which then became my wish. Likewise, it's 1st of December, so I'm within the parameters with my insurance. Because one thing I will say now, my copay for the just the doctor visit for the surgery itself was $1,700. But it's funny when all of a sudden you got deductibles paid up. The second surgery, the surgeon's fee is $300. So let's be honest, guys. There's a big difference between $1,700 and $300. So I would imagine some of the other ones, like this, the surgical facility, the therapy, some of the other stuff for the second one is going to be dramatically lower. So that's going to be a great blessing, which then when you add them together, which would have been the equivalent of me having a lower copay and a lower deductible insurance. So at this point, today you could say I'm on cloud nine, where really I think I got some very good news today. One might concern the first surgery, and then the second part of that was to make sure that I was going to be healthy enough to have the second one and then get ready for that. Now the third visitor I had was she was a nurse, but she was more like a tech assistant, and her job was to get the staples out of my surgical area. So with me, it wasn't truly on the side, and it truly isn't on my backside. So I really cannot take a good look at it. And I know I could take a video or whatever of it, but really I was kind of like, I don't know if I really want to see it. So I asked her. I said, she was bragging about it too. Oh my God, I see a lot of these obviously, and your surgical area is great, seems great. Then we were talking about staples. She said, well, I'm going to get those out of there. And I didn't know. My wife and I, we kind of figured, maybe 10, 12 staples in there. There was 32 of them. So she said, hey, some of them may pinch. So as she's going through, and like I said, 32 of them, oh, did that hurt, Greg? How's that? And I was like, maybe 5 or 6 pinched a little bit. I said, no. And her name was Rainey. And I said, no, Rainey, this ain't a big deal. I'm just glad to get those out of there, because I said, now if we went any longer, really what happens? And what she had told me is, in the body, the great mechanism that it is, after a while will start to grow over those. The skin will start to grow over those. So she said, oh yeah, it gets to be a little bit of a pickle, in a little bit of time, not too much time after this, where I'd have to really dig them out, because your body's figuring, okay, well now they're a part of us, and we're just going to make sure they're protected. So, but with that, I've had like I said, today was a very good day. So now it's a matter of looking at the second surgery. My wife and I were talking earlier. Now going into the second one, the surgical part, I know what to expect now. The fact it was a success, I don't have to necessarily have fear, because I trust the surgeon. I trust all the other people, all the other moving parts, if you will, that are involved in that. No problem there. So that's not going to be a worry of mine, because I think what was going on, and my wife, what she had told me about maybe rushing the surgery, was playing on my mind, that if it was a 4-week differential, is my left really recovered enough to compensate that now I'm freshly on another, on a hip from day one trying to recover, and that was making me leery. So what I will say, guys, is the 8-week in between, great news. Now I think what I'm gonna do, and I noticed even like yesterday, sometimes it's life comes at us fast and furious. So I think what I'm going to do is I think I'm going to try to video blog about every other day, unless obviously something happens really earth-shattering that I really want to share. So I think about every other day, and I can kind of recap the day before. So I think that's what I'm going to try and do going forward. So with that, I'm going to let everybody go, and I hope you have a great Friday night. Have a great Saturday. And what I'm going to do is I'm going to talk at you guys Sunday, and tell you how tell you the last day and a half or so is gone for me. So with that, have a great night, guys. Have a great weekend, and talk to you Sunday. Bye.